After certain injuries or surgeries, it can sometimes feel difficult to be able to put weight on a leg or feel like you have good balance. Here's a series of activities that we like to use to help get more comfortable with this idea. Make sure that you're following any specific recommendations by your physical therapist before continuing. The first exercise is weight shifts. Stand with your feet flat on the floor and holding on to something sturdy in front of you for balance. Shift your weight from one side and slowly to the other side, going only as far as is comfortable or as far as you feel like you have control of. Use your arms as much as you need to, but the goal is to really just use your legs as best you can. Once you're comfortable with this and feel like you can comfortably accept some decent weight on your affected leg, you can move on to an exercise like heel raises or calf raises. Keeping your hands on that solid surface in front of you, what you're going to do is push up on both feet, lifting your heels up off of the floor as far as you can comfortably go. Hold for just a second and then slowly lower yourself back down. The goal here is to minimize the use of your arms so that, again, your legs really have the best opportunity to do most of the work. If you find that your affected leg still has some difficulty taking that much weight on it, you can shift your weight a little bit more towards your unaffected leg to ease the work on your affected leg. Then, as you get more comfortable, start to shift more weight towards your affected leg. Eventually, you should be able to get to the point where you can do one leg at a time rather than needing both feet to help you. The third exercise that we're going to talk about is single leg balance. Again, once you're comfortable after something like weight shifts, this is a good one to really work on balance. Now, what you're going to do is, again, with a sturdy surface in front of you, shift your weight completely onto one leg, keeping your other foot off of the ground and ideally away from your standing leg so that you can't use it as a prop. Use the surface as much as you need to at first, with the goal of starting to decrease that contact. Maybe you can move to just fingertips and then can slowly work on lifting your hands away.